To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we're going to talk about back pain because I am joined by Dr. Patel from Alleviate Pain and Spine. Great to have you back, Doctor.
Thank you. It's great to be back. Thanks for having me again. So back pain is incredibly common, as you were mentioning. We have many causes that have it because we're using our back day in, day out, and we strain it very easily. Most common things that cause that back pain can be musculoskeletal, the muscles strained or are deconditioning. The joint itself in the back can get arthritis. The bones can get swelling or inflammation in them, or they can get breaks, which those fractures need to get repaired. And the most common things we see are disc degeneration or disc herniations, which can pinch nerves and cause pain that travels into the patient's body. And all those different conditions need to be diagnosed and treated with very specific treatment plans.
Yeah, it is so common, and you just listed all the things that could go wrong with the back to lead to chronic pain. I always hear about sciatica. Oh, my sciatica.
Yes.
I don't know if I actually know outside of a nerve what it actually means, and how does one have a problem with sciatica?
Yeah, so sciatica is a very common buzzword that's thrown around because it's so easy to describe pain. The most common presentation of it's back pain that shoots down or electrically zaps down someone's leg. It can be one side or both sides. When it does travel, sometimes you get some numbness, tingling, and possibly even weakness associated with it in the legs. For treatment, we typically would bring someone in, evaluate their signs and symptoms, get an MRI to see what is going on and where the exact location is. And then from there, we either treat it conservatively with a therapy medication route or go towards a procedure if necessary. There are some patients that have very debilitating pinching of that nerve and require surgical evaluation, and we can send patients to the right surgeons based upon what is presenting and how bad their symptoms are.
I'm always curious because you laid that out. We're copers in Wisconsin. We just cope.
Yes.
At what point do we say, I need to go see a specialist like you? When do I know?
Sure. I feel like a lot of people use the word chronic pain or chronic back pain. Once you're starting to label pain as chronic, you've gone too long.
Okay.
So most patients, 3 weeks, 4 weeks, they start to see relief through some type of conservative measure. They bear through it and they grit their teeth and they're better because the body does heal. When it gets that setting of not healing on its own and it is bothering you, there are things that we can do to speed that healing process along. Or if it is in that chronic setting where it's been going on for many years, there's treatments we have to help reduce that pain and alleviate it so that way it's not as prominent and interfering with their day-to-day.
All right. Well, Dr. Patel, thanks very much for being here and kind of walking through when we should get rid of that back pain and coming to see you.
Of course, we'd love to help the community and treat that back pain as quick as possible.
All right, Doctor, thank you for being here, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.